Hello, assalamu alaikum. Welcome, Dr. Obdi Live. Today, the topic of discussion is regenerative aesthetics. So this is I know it sounds very confusing. What is regenerative aesthetics? Regenerative aesthetics is actually very passionate to me. I'm really passionate about this field because it's a cutting edge field. It's the latest field in medicine. And it's not just for plastic surgeons or aesthetic physicians, but also for orthopedic surgeons, for spinal surgeons, because we are using compounds and ingredients in our treatments which are promoting cellular growth, which is very exciting. So whether it's for skin, whether it's for hair, whether it's for nerves, whether it's for a lot of things, it can really help to improve your bodily health and your function. So in the field of aesthetic surgery and medicine, the 2 or 3 new compounds which have just recently been discovered are exosomes and polynucleotides and biostimulatory fillers. So anything which will create collagen or induce new collagen formation and make your tissues more healthier, optimize them, can be termed regenerative. Non-invasive, even HIFU or radiofrequency treatments can be termed as regenerative treatments. But compounds such as exosomes, which are basically stem cell signaling compounds, which really help to kind of improve the health of the tissue where it's being used. For example, injecting exosomes or applying them to the scalp or the skin, they will definitely the health of the skin or the hair and boosting collagen and improving the quality of the skin. So exosomes can be used for such problems. Polynucleotides, I like to inject them a lot these days. They're great for the under eye area. So a lot of people don't like the effects of teardrop fillers if they're not the right candidate, to be honest, or if they've had issues with it. Not every patient, but maybe let's say 1 in 10, they didn't like it. They're good for a candidate for polynucleotide fillers. What are polynucleotides? They're basically going to help with deep cell hydration, help with collagen and elastin formation, and they're regenerative. So they're going to improve the quality of the tissues. They're going to thicken the skin. So if you've got really thin and dry area, it can definitely get more plumped and look much more healthier. Please keep in mind that you might need 2 or 3 sessions for this. But I've yet to see a patient who has actually not had a good result with polynucleotides. So it's like one of the personal favorites of mine these days. I also like using polynucleotides in the cheek. I also like using them in the neck. In regenerative aesthetics, these are the 2 or 3 new compounds. But in biostimulation fillers, things like polyalactic acid, Sculptra, Lanuma, Radiesse, and Elance, I like to use these fillers to do the same thing. So when you inject them in your skin, they're going to build type 1 collagen, which we need. That's the one which is actually going to be triggering more collagen and much more plump skin and thicker skin and improve and counteract the signs of aging. So I use them in the right candidates. So it's not for everybody. So for some patients, one compound might not be suitable, the other might be. That's why please choose a doctor who actually knows and has experience in these injectable treatments, because these are definitely they're much more longer lasting as well. So they're not like hyaluronic acid fillers. Hyaluronic acid fillers are wonderful for the lips, for the cheeks, for the temples, for the chin, anywhere, even the body, buttocks, I use them as well. So hyaluronic acid is great as it pulls water and it's biodegradable. So all of these injectables are biodegradable, but hyaluronic acid, it gets degraded a bit more faster. So in certain areas, it can last 6 months. In certain areas, it can last 1 year or even 1.5 years. But these other compounds, the ones I was mentioning, biostimulation products, injectables, they're going to last you about 1.5 to 2 years or even more sometimes. So you have to really speak with your doctor and understand which one of these compounds, injectable compounds, can help you. But I believe that all of these compounds can help a wide range of patients, males, females, and any age, to optimize skin health, to make you look fresh at any age. But obviously a good in-depth consultation will allow you to choose the right product and get the best results.